it's time to bring in our guy, fellow who makes a lot of time for us out of his own goodwill, and he's been a part of this morning show for over 30 years, and that's Dr. Joe Congini from Sports Medicine Center, Akron Children's Hospital. And Dr. Joe, what do you have for us this morning, my friend?
Hey, Ray, first thing I have for us is thanks so much for all the community things you do, really. It's amazing, and you're such an important part and do so many great things in our community. I'd be remiss if I didn't mention that.
Thanks, Joe.
I wanted to today kind of highlight the difference between injuries sometimes that occur in the mature athlete, college and professional athlete versus the high school athlete. And it really comes out with an injury that is really high profile. And it's the star athlete for the Dallas Cowboys who was traded to Green Bay, Micah Parsons. And when he got there, the discussion was that he really had been struggling with some back pain. And so Micah Parsons, wonderful athlete, great player, was paid $188 million for 4 years, the highest non-quarterback, $47 million a year, I believe guaranteed. He passed up our friend Myles Garrett, our neighbor and friend here, and T.J. Watt and all these great players, and made a lot of money, but they have a really big game against the Detroit Lions. You know, this is supposed to maybe be what this division comes down to. It's early, but should he play with a facet sprain? And so all over town, sports medicine people try to make decisions, good decisions about allowing people to play or not. And reading up about this injury, oh my gosh, they really went into a lot of detail. I read several articles about Micah Parsons, and the injury that he has is called a facet sprain, and we see these quite a bit. But in younger athletes, Ray, very different. This is the one, and I've talked about it a lot here, that is really more presents with a lot of twisting and arching in the back. This little joint on the side of the back, they even went into detail about which one it was for him, the L4, L5. It often will get a stress fracture in it, and those people can't play, and they need some rest period, but they do well in about 4 to 6 weeks. But in the professional setting, a lot of times it's a sprain of the ligament. So to speed things up, we can get professional athletes or higher college athletes playing sooner. And one of the techniques in doing that for years and years was the use of a steroid burst called prednisone. And they mentioned in several articles that he was given prednisone, and it has worked just okay for him. There's a thing called a dose pack that a lot of athletes may get. People may talk about this dose pack or prednisone pack, where you start with a higher dose for day 5, then 4, 3, 2, 1. And they try to, with this burst, knock out this inflammation with prednisone. And it's not used just only in the injury world of sports medicine. It's used for allergies, asthma, arthritis, infections. So dose packs are used quite a bit. But there is some side effects to the use of steroids, too, especially in our younger athletes. And so what I've seen, and this is, again, the benefit of years of practice, in the last 10 to 20 years, there's definitely been a decrease in steroid dose packs and prednisone. I used to get many kids sent to me from an hour away and beyond who would come in. They'd already tried a dose pack. Oh, my gosh, some pretty young kids on a high-dose dose pack. Not used nearly as much anymore because people are looking for other ways to treat these things. And so at our center, our specialist and director, Dr. Derek Eddy, is such a talented guy. We spoke last night. He's our procedure specialist, so he does a lot of injections, and they are talking with Micah Parsons about getting an injection in that little joint, and Derek does those for us, and so it's another technique maybe with less risk than using the steroid dose pack. He also admitted to me that, in the last several years, as things evolve, we are seeing less use of these prednisone dose packs. So injecting that facet joint may get this thing quieted down enough for him to play, and it's up in the air whether he'll play or not. But all over town right now, as sports have gotten started, sports medicine teams and then specialists are weighing two things, really. In the short term, is it going to cause any problem? And in the long term, is it going to cause a problem? So we're not going to want to let people play if they have the risk of making things worse for their future in the long term. And the other thing is, how big is the risk and benefit? And so we really need to know in sports medicine, experienced sports medicine teams, what is the risk and the benefit of this type of treatment that we're going to use? And there's so many good sports medicine specialists in Akron and in Ohio overall that do these. Dr. Eddie is one of the best of them. And so during the week, you're kind of weighing what might be the best choice. What is this going to be a short-term or a long-term type injury? And there is a big difference in this type of injury in a professional athlete like Micah Parsons and a high school athlete that would have a facet joint injury. And so they are treated differently, and the dose packs of prednisone are decreasing. Those are 2 points I wanted to make this morning, Ray.
You know, Joe, a lot of times when you mention the word steroids, certainly it says shivers up the spine to most people uneducated with steroids because they go back to the anabolic steroid of sports and everything. But steroids do have a positive use for sure, as you were saying, in the world of recovery and the world of athletics.
Oh, my gosh. I mean, they can be life-saving. So thank you for making that point. And it's a point I think we've made here in previous years, but worth making again, is anabolic steroids are the ones that our athletes used quite a bit around the turn of the 80s and 90s, and we lived through that, to bulk up. And they were bulk up steroids, but they definitely had a pretty high side effect profile. The corticosteroids, totally different, cortico versus anabolic. Corticosteroids like prednisone can be life-saving in a lot of situations. I went over just a couple there, but there's many, many times that these can be life-saving. But many times we're really facing, is that necessary to use a big gun like a corticosteroid at a higher dose in a young athlete versus other things that we could use that might be safer. So everything is always a risk-benefit ratio and a short-term, long-term ratio as your sports medicine teams out there are trying to make decisions on should kids return to play or not.
All right, Joe. Great information as always. Really good insight into the world of sports medicine, and he does it each and every week for us. Joe, thanks, my friend. I appreciate it.
Thanks, Ray. Enjoy this beautiful weather.
No doubt about it. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, part of this morning show for over 30 years. He joins us Wednesdays at this time. Really good education into the world of sports medicine.